Hi, good evening everybody. My name is Maryke. For those of you who don't know me, I am the physiotherapist from sportsinjuryphysio.com, where you can get online physiotherapy treatment via video call. Now, tonight's session is all about you. I've put it open to the group and to everybody on social media to ask the injury related questions that you would like answers to. So this is for whether you are injured or whether you want help with this patient maybe, or if you've just got some fun questions like some of them I've received. Okay, so if you're watching this live, if you've got any questions or that you want to add of your own, or something's not quite clear, then pop it in the comments. If you're watching this on replay, you're welcome to ask questions in the comments as well. And I will be reposting this one on YouTube later tonight. If you struggle, if you want to pass it on to anybody, you can do it from there. Okay, so my first question is from Tony Watts. His question has two parts to it. The first bit is, he says he wants to know why his quadricep muscles, the quads, the thigh muscles, get so sore and tight after running 6 to 10 miles. It's enough soreness to make him stop for 2 days, and he describes it as DOMS. That feeling of DOMS stands for delayed onset muscle soreness. And then the second part of his question is the best way to help glute strength as marathon training, but when I get up to 13 miles, glutes give up. Thanks. Okay, so let's look at the first bit of it with regards to the muscle soreness when training. Now, we develop muscle soreness or DOMS in reaction to exercise that is new to the body that we're not used to. And it usually goes hand in hand with exercise that's heavy load or eccentric in nature. Hi, Gemma, glad you can join us. So what do I mean with eccentric exercise? I guess the best or the easiest way is to demonstrate on my bicep muscle. Let me just get myself into the picture. So if I contract my bicep muscle that it shortens, then that's a concentric movement. If I slowly lower my arm down, my bicep muscle still has to contract, but now it's got to lengthen, and that's an eccentric action. For the thigh muscles, that's the same as running down a hill or walking downstairs. When you do that action, it's much harder for the muscle to work because it's got to lengthen now and control the movement while actually contracting. So if it is true DOMS or muscle soreness that you're getting from damage because of the training, then the main two reasons is that either you're not used to the type of terrain you're training on, so that'll be that your running suddenly involves a lot of more downhills in it, or it can be that it's a much harder session than what you're used to. So is it that you're jumping into 6 to 10 miles, or is it that if you've built up slowly to that and it's not new terrain, then I would query whether it's real DOMS that you're feeling and whether it could be linked to something else. And I tell you why I ask this, or why I think this. Your second part of your question is that your glutes gives up when you get to 13 miles running. Now, it would be interesting to chat a bit about what does it mean for you when you say your glutes give up. Does it mean that they become very painful? Does it mean that you get a tired feeling in them? Is it that they feel really stiff? All of that's quite significant because that will tell me a little bit more about whether it is true tiredness that you're feeling. It could be coming from the lower back. If you have an issue with the lower back, it can give you a feeling of tightness or heaviness in the glute area, and it can actually affect how well those muscles function. And again, the lower back can also give you discomfort into your thighs. So I don't know if these are two things that kind of appear separately, or whether it's things that's been repeated over years or just at different times in your life. That would all make a difference to which way I go with my diagnosis on this. But what I'll do with regards to glute exercise, I'll pop a link in the comments of this video for you, Tony, because I've done a couple of blog posts actually, which shows you some of my favorite type of glute exercises. The glute bridge, but especially with your feet lifted up onto a chair or a little step, is a great way of strengthening the glutes. But simple other exercises like single leg squats or just double leg squats that's weighted, they also strengthen the glutes really well. You've just got to be careful if you're busy with marathon training at the moment, where you schedule the strength training in. Because if you're already upping your volume of running to something that you're not used to, and then you want to add strength training on top of that, you are at risk of overdoing things. So you've got to really go and sit and have a think about where you put this in, that you still allow enough recovery time as well. Those were my main thoughts on that subject. Hope that answers it for you, Tony. Let me know if it's not quite the answer you were looking for. Okay, then we're moving on to Darren Fraser. He's asking, as a physiotherapist, if you were running the line in sport, what 10 essentials would you want? Okay, so it really depends on the type of sport I'm working at. So I've chosen rugby because rugby used to be the one that I worked at most. Now the bag, I actually cheat a little bit. I have two bags. I have my one bag that I have on me that I run with, so it's not packed full of stuff. And then I have another bag that if it's a more serious thing that needs a splint or something like that, I'll shout for a minion to go fetch that for me. So in the bag that I have with me, that I run on the pitch with, is first of all, I have included the bag, which is a backpack, so that I have my hands free and that it's easy to run with, because I've tried running with really heavy bags and it just throws you off balance, and in the end you look really silly going onto the pitch. Also slip risk. So definitely a backpack of some sorts or some bag that can sling easily. Then scissors, because there's inevitably something that I need to cut either off the player or taper something that doesn't want to cut. Gloves, because rugby, there's a lot of contact involved and there's always blood. And I usually tend to have a glove on one hand in any case. I tend to have one hand free because otherwise, I don't know if you've ever tried handling tape with two hands in gloves, but it's a nightmare. Gauze, coming back to the blood thing, nothing like gauze to just quickly put on something to stop the bleeding. Now, that's as much as I would have in my bag with regards to blood injuries, because for rugby, we then take them off the pitch and have to go fix the injury off the pitch properly. So I'll take them to my big bag for the rest of that. That takes us to 4. So number 5 is zinc oxide tape. It's that really rigid tape that doesn't stretch. And I'll have it in 2 thicknesses, actually, the thin ones and the slightly thicker ones. Great for quickly strapping fingers that's sprained or anything that you can just give a quick bit of support to. In the same sentence, I'll also have elastic adhesive bandage, which is the thicker white tape, sticky tape, because it's great if somebody's sprained a wrist to just put it around that a few times and it just stops it from going into those end ranges. Also, if they want a quick ankle strapping, that can be quite useful. But my other item there is self-adhesive bandage, which is the stretchy stuff, which you can use as a bandage, but it also sticks to itself, because that's great for quickly strapping an ankle or something actually over the rugby player's boot that the foot can't twist. Then magic spray or ice. Never go anywhere without magic spray, because apparently if you spray cold spray on something, it makes it better immediately. Which is a bit bizarre, because rugby is played in the UK in the middle of winter when it's about 2 degrees centigrade out there, and that spray is definitely warmer than that. But it works wonders psychologically if you can just do that to the player. The ice is quite useful because, yes, it helps to cool it down. It helps for the pain while you're examining. But also if you've got a blood injury, then it can help to stop the blood quite quickly. Then electrical tape, again, to tie things down that you have to quickly apply because you don't have a lot of time to treat people on the pitch. So if it's something that needs to be fixed on the pitch, you need to be doing it, make sure that it stays in place, especially when you think of ears and stuff that needs to be stuck into place. And then my last item is water, because it's a very good way of calming the player down when they're in pain. Just a few sips of water. Also, it dehydrates them while you're having a look at what's happening there. And it's good to just wash things off if you want to see, is there anything you need to be looking at under a lot of mud or under a lot of blood, what the extent of the injury is. So that's my essential things that I would want to run up onto the pitch with. The rest of it is all in a big old bag, which if I really need it, everybody knows where it is, and the person who knows it's their job to get it will fetch it for me. Okay, so then we're moving on to Gemma. Oh dear Gemma, you have had a few injuries in the past year, haven't you? So at the moment, she's got a rotator cuff tendinopathy that is preventing her from using the computer at work, and it's also painful when she's running. Um, how do I rehab this is her question, and why am I getting all of these tendon injuries? She's had an Achilles tendon injury recently, as well as a medial collateral ligament injury, and she says my diet is good. Actually, let's answer that last part first. Diet doesn't have a lot of influence on your tendons and your ligaments. As long as you're eating a relatively balanced diet, that is more than enough. Gemma, I think in your case, I would be querying whether you are showing any signs of the menopause or perimenopause. I did a talk about it a few weeks ago, and I roughly know what age group you are in, so I think you may fall into that category. And the problem with the menopause and the perimenopause is, as females, our estrogen level starts to drop. And estrogen is in charge of producing your collagen in your body. So immediately, and tendons and ligaments are mainly made up of collagen fibers. So what this means is you're not as good as repairing it as quickly as normal. So where you would normally take 24 hours to recover after a training session or a exercise session or even just working in the garden, it may now take 48 to 72 hours for that tendon to repair. So your chances of micro trauma going into a proper injury is much more likely, or it's much easier to actually get that. Then also, because it's in charge of that, it means that your turnover of your tendon collagen is in any case slower. So, I'm getting a big yes there from Gemma, so I'm guessing that's a yes to the menopause or perimenopause. So what that means is all our tissues in our body are constantly renewing its fibers. And I can't remember, but it's quite interesting how many times your whole skeleton renews throughout your lifespan. But the same goes for tendons and ligaments. Now, because of the lower estrogen levels, this turnover is much slower. So the quality of the tendons and things are lower. Now, you may think that there's nothing you can do about it, but actually there's quite a bit you can do about it. One is you can really look at and analyze your activities and your training schedule and just have a look whether you need to be cutting back on the high level activities for a bit and bring in more low level or low load activities. And if we're thinking of specifically the arms, we're thinking of repetitive movements as well. So it's even house tasks or gardening. All of those things counts there. So think a little bit about that. Second is tendons and ligaments and things do like strength training. So building in 2 proper strength training sessions that strengthens the whole body per week is a really good thing to do. But remember not to jump into it too quickly. You've got to ease into it and respect what other things you're doing in your program already. So that would be my main advice with regards to the general injuries you're getting. Also, there is some evidence that HRT, hormone replacement therapy, can work. There's a massive lack or void in evidence for or research for alternatives. So it would be really good if somebody knows of good resources. Somebody has actually shared some stuff with me recently, but I haven't had time to read it. I will get onto that and share it with you guys at some point. But if there's good alternatives, I know there's certain foods that normally that in any case has growth factors and things in them that seems to have a good influence or a positive influence on menopause. But if you know of anything like that, please pop it in the comments. So then your second or your first part of the question was actually with regards to the rotator cuff tendinopathy, what rehab you can do for that. Now, Gemma, my first question would be why you have the tendinopathy, because you always have to go and have a look at what caused it and making sure that you're not carrying on with whatever caused it. In the shoulder, it is overuse that causes it, but it's also to do with compression forces on there, and posture is a very important part of that. So the first, especially if you've got a really painful shoulder at the moment because of that tendinopathy, a good place to start is with posture exercises. So remember that your shoulder blade is actually, I need to make I'll pop a link to, I did a blog post about shoulder impingement, and some of those things will be relevant here, so I'll put that in as well as the link to the glutes in a minute. So if we think about it, that your shoulder blade position is quite important for how well your shoulder can move. So if the shoulders are rounded, it means your shoulder blade has come forwards and there's less space in your shoulder to move before the bones contact each other or squashes the things in between. So if we're thinking of the tendons attaching in there being painful at the moment because of the tendinopathy, if you're going to have poor posture, you're going to continuously make that pain worse. So the first place to start is to make sure you address your posture. So it's not just shoulders back, but it's actually also bringing your chin into where you should be. So a really easy way of correcting that is just trying to push the ceiling away with your head. Now, it's not like that. It's literally the back of your head pushing it up. And you'll notice that as soon as if you're in a slouch position, as soon as you do that, everything improves already. From there, yes, there's it's the regular old rotator cuff strengthening exercises, but where with the Achilles tendinopathies, I get my patients to push into pain, I find with the shoulder ones, I have to work them just short of pain. If you're going to push through pain with this type of injury, for the shoulders, I find it makes them worse, but other people may have different ideas. So usually start with rehab below the level where the impingement starts to happen. So if you're doing lifting up exercises, just to that level, and turning out ones, avoiding the full ranges at the start, but working into it later on. On that note, you mentioned you're struggling to do computer work at the moment. So if you were my patient, I would ask about your setup at the computer. So making sure your shoulder, your arm isn't hanging free. So I wonder if I can show you this. If I had to type here now, can you see that my forearm and everything is unsupported? So essentially my shoulder has to work quite hard to keep me in this position. So if you can make sure that your desk is, or your chair is right in underneath your desk so that your arm is supported, then that cannot take some strain off your shoulder already. Also, a narrower keyboard can be quite useful because the wider it is, the more range of movement you've got to use. But that said, it will depend on your body size. So try a few different ones out and see if there's a way that you can make it easier. But I would definitely say if you're finding it hard to work at the computer, see if you support your arm, if that makes a difference. And Gemma said, also taking bioidentical progesterone works very well. Oh, great. Okay, excellent. So let me just get myself properly in the view again. Okay, so then we've got Dave Webster who said, what are the best exercises to help recovery of a medial meniscus tear? To be honest, Dave, it's about strengthening the glutes, because when we think, let's take it back for a moment. So meniscus tears, what do menisci do, or what forces do they resist? Your meniscuses are your little cushions inside your knee. They are horseshoe shaped and they are made of cartilage. And they are quite sensitive to rotation forces. And one of the most common ways that people injure them is if they've got a planted foot and they twist quickly on it. So at the beginning, when your meniscus is recovering, I want you to be careful that you avoid rotating your body on feet that are planted. Also, deep kneeling can strain the meniscus quite a bit. So definitely at the beginning of your rehab, I would say for the first 12 weeks, I usually get people to avoid the deep kneeling positions. And then also stay away from off-road running for a bit, because the twisting in that and even walking on uneven ground can put a strain through that and keep your pain going. Now, if we get back to the exercises, it is things for the glute max, glute med, because remember, if your leg doesn't move in a straight line and the knee kind of moves in when you're running or walking, that will put a rotation force through that knee, through the meniscus. So you want to have a stable leg. Then also quad strengthening exercises. So we're thinking about squats and all the variations of that, and lunges and everything like that. But always start with the more stable ones first. So if I had to choose exercises for an acute meniscus tear that's about 2-3 weeks old, within the first 2 weeks, I would just go for range of movement and give it everything it wants. So protect it a little bit. Make sure you move it, because remember, your knee doesn't have arteries going into it. It needs movement to get fluid in and out. So if you want that meniscus to get all the nutrients it needs to heal, you need to keep that knee moving. but within pain-free ranges for me at the beginning. Cycling is a great one to tick that box because you'll get a lot of movement in there. Strength training wise, I start people off with glute bridges again, usually double leg ones, and depending on where you've torn your meniscus, it may be quite happy to go into single leg ones already, because depending on how much the knee is bent, you will strain a different part of the meniscus. So it's all about how your knee reacts when you do these things. Then again, moving from double leg squats to balancing things, supported single leg squats, eventually to single leg squats on their own. I don't know if you ever saw that video I did about the single leg sit to stand as a strengthening exercise. I'll again pop a link to that in the comments here as well, that you can go have a look at that, because that's a really good exercise that you can guide with your hands at the beginning. I tend to put a chair on each side of myself, and then put a few pillows on the chair that I'm working from, and then support myself as much as I can or need to get from sitting to standing on one leg. And then as it gets better, you can use less and less support, and that way strengthen it. But definitely, if I had to choose just 2 muscle groups to strengthen, I would go for glutes and quadriceps muscles for that. But it's all about the control there. Okay, let me just see if I have left anything out that I wanted to say there. Yes, and it comes down to load management again with the meniscus as well, Dave, because often people can be so keen to start doing strength training for the meniscus injury that they actually push too hard at the beginning and squat into pain, and they make the swelling and everything worse. So just remember that you have to go according to the stage of the injury. You've got to choose your exercise. So at the beginning, when it's really painful, you go for just movement. As the pain decreases, you go for double leg supported things. And as it gets stronger and less painful, you can start with less supported things like the lunges and stuff. But that's around, depending on the injury, around 6 weeks that I usually put that in first. Good. Then the next one is about plantar fasciitis. Am I right? Yes. So Linda is from Ireland, from Cork, West Cork, and she is a running coach, and she's got a problem because they're doing adult running group and they're upping the mileage, and now she has developed plantar fasciitis. Been using ibuprofen, but it just knocks her out, and she's been using ice and intense heat, but it's just not really working. Linda, the first and most important thing is to understand the nature of this injury. So with plantar fasciitis, it's absolutely an overuse injury. So the plantar fascia is, let me just get my foot up here, underneath your foot there. It runs from your heel bone to attaching to the front here by the toes, and it's usually in this area that the severe pain happens. Now, why does it happen? So what the plantar fascia does is it stops your foot from collapsing flat as you put weight through it. So it develops a strain injury there, or overstrain injury there, when the load that you put through it is too much for it to handle. And it can be that because you've been increasing your mileage, it's gotten to the point where the rest of the legs and everything were too tired and too much force went through that bit. It can be if you've suddenly done a lot of downhill running, so a lot of pounding on that. And then again, it was more strain than what the plantar fascia could handle at that point. Because remember, it's again, like with everything, your plantar fascia is really strong. And if you prepare it for the load that you want to put through it, it can handle a lot. But if you up it too quickly and it doesn't get time to recover, then that's when the problem comes. Other things is if you wore shoes that didn't support it enough. So if you used to supportive trainers and suddenly you used minimalist shoes, or shoes that's very flexible, or sometimes shoes that's too hard, that can cause trouble. It could have been that your feet were tired from standing on it all day, and then you did a long run. So then it was cumulative. So go have a look, because you're going to have to change what happened there if you don't want it to come back. Unfortunately, the main treatment that works for plantar fasciitis is that you have to offload it for a period that it can help start to recover and support it. So it's load management. this is not an injury that you can run off. If you're going to keep on pushing into pain with this and causing it to be worse and more painful in the next 24 hours, you're going to keep on intensifying the pain and you'll have to eventually fully stop. Now that said, there are loads of things that you can do to help it. The first I would do is I would check my shoes and make sure that they're not old, make sure that they're supportive enough. You may even need a bit of a softish orthotic in your shoe to help support you. Now, on that note, two types of orthotics. You get the ones that supports the arch, so they will have a rigid bit in there, and they're not made of gel. They're quite firm, and those can be quite useful because it stops the plantar fascia from overstraining so far when you're stepping on it. And for a large chunk of my patients, that works really well. Another chunk of my patients, that really doesn't work because that pressure is too hard on that. And they find the gel heel cups that you can get really useful again. Then things like flexibility work, so stretching all the muscles from your glutes, your hamstrings, your calves, everything down, as well as doing massage of those, have been shown to be useful. But I would say my first line of treatment would really be to figure out what amount of load or activity you can put through it that just make you aware of it, but doesn't make the pain worse afterwards, and especially not the next morning, because you have to start training at that level if you want it to recover. Now, I don't know where you're running. If you're running off-road, this may not work, but if your group is running on the road, you may want to consider doing something like cycling next to them or something like that to just not have to do all the load with them. But it's very difficult to give you more specific advice without actually knowing how bad your injury is, what your training load looks like, and what the rest of your day looks like. While I'm on that point, remember, try to cut out any other activity in the day that puts load through your plantar fascia as well if you want to be doing the running. So often you may find yourself standing when you could be sitting down, things like that. Now, normally I wouldn't tell people to rest the injury that severely, but with plantar fasciitis, if you do not have to stand on it, do not stand on it, because you're putting load through it that's not necessary. Rather keep that endurance that it has for when you want to go for your run. I hope that makes sense. Let me just see what's coming through here. Okay, Darren, I'll get to yours in a minute. Yes, that's all I wanted to say about the plantar fasciitis there. Okay, so Darren's asked, what is my opinion about IT tape and K tape? With IT tape, do you mean IT band tape, or was it just that you misspelled K tape? Anyways, I'll give you my opinion about both. So K-tape is an interesting one. Kinesiology tape, it's known as rock tape. You get different brands. What's the other types that you get? It's basically the colorful stretchy tape that you can see loads of runners run with or athletes have on them. Now, the things that we know from the research that it definitely doesn't do is it doesn't really activate your muscles. It doesn't really, there's a lot of the fancy stuff that they say, it doesn't really do that. What I will say is that it does affect the sensation of pain. So, and I've experienced this for myself, where for some injuries it's worked marvelously, and then others it really hasn't worked. So what it does is it creates a different sensation on the skin, and that sensation can block pain signals. Now, for some things, like for anterior knee pain, that can sometimes really work marvelously. And for other things, you'll find that it has absolutely no effect. I haven't quite figured out why it sometimes works for some and not for others, because to be honest, it could be placebo, but then I would argue my placebo effect should be constant, that I believe in it equal amounts on different days. And I've definitely had it where it's worked for some injuries and it hasn't worked for others. The one thing where I do find it useful is for bruising, and I don't know if if you Google bruising and K-tape, you'll get pictures up of people where they've had a massive bruise on the thigh, for instance, put strips of K-tape over it, and then when they take it off a day or two later where the K-tape was, there's no bruising left. And they think this is because the K-tape has been designed with, you'll notice that at the back there's the stickiness on the tape is kind of in layers, and it's been designed to lift your skin micromillimeters, which helps with your lymph drainage. And your lymph system is the system that gets rid of all the rubbish and the old blood that would have accumulated, gets rid of all your byproducts of cells, your swelling and things like that. So if I have somebody with a really swollen joint or something, again, I would use it. One, it feels quite secure and comfortable, but two, I do think it has an effect on the lymph drainage. But that's just my opinion. For the IT band specifically, if you take it down the side, again, I've had it where it's worked really well for people, and then for others it's not worked. And I guess if I think about it, I would say that a lot of the time an injury have already healed, but the pain signals are artificially still going. And I think in those cases, the tape can be quite useful to switch those stupid pain signals off that shouldn't be there. But I think where the acute injury is still there, it doesn't make that much of a difference because there's something else driving the pain. It's not just your sensation that's a bit over the top with the pain signals they're creating. Okay, so I think that's all my questions. Now I've got a little bit that I want to add of my own. Off the top of one of the posts in the sports injury group today, or was it yesterday, from somebody who finds himself stuck in bed with a foot injury that is going to take at least 9 months to recover, and he's been told that it would never be the same again as it was before. There are so many injuries. You've got to, if you find yourself in the situation where doctors have told you that you will never be able to run again, or you will never be able to walk without assistance again, or you will never be able to use your hand again, then understand that they have to give you your worst case scenario, and in some cases that may be true. But I want you to not try and take that as the truth without trying your best at the same time to change it a bit. The first thing I want to say with regards to that is that nobody can truly predict that you will not be able to do something again. And I've got a really good example at the moment of somebody I saw on Monday. He's an elderly gentleman. He's deep in his 80s. He's 87 years old this year. Now, a year and a half ago, he fell on the golf course and he dislocated his arm. And unfortunately, he created a brachial plexus injury, and he was paralyzed from up there all the way down. So by the time that he came to see me out of desperation, because everybody just said to him, we don't know how long it's going to take. You're probably never going to use your arm again. Just do a few wrist movements. So his son made him come and see me. And initially I thought, oh, what am I meant to do? Because honestly, he didn't even have he was starting to get his rotator cuff movement back, to be honest. And at that point, his hand was stiff because he wasn't really doing the exercises because he'd lost all motivation. He was just picturing that he will not be as active as he could be anymore. He won't be able to play golf with his mates. He won't be able to work in his garden. He won't be able to lead the life he wants to lead. So he came to me. He was in a sling. His wrist was totally solid. I could do flexion a little bit. I couldn't get that wrist to extend past there. His thumb was stuck. Everything in the hand was stuck. His elbow was stuck at a degrees like that. But then I read the letter that his last consultant had written to his GP, and I realized that, wait a second, in that letter, he still had no movement around this area, and he was definitely getting movement in that area. So what I did then was I decided, well, he probably won't do much with that arm again, but I didn't say that to him. What I said to him was that if he works at it, but he's going to have to work at it all the time, he may be able to get some of it back. And I made a point of seeing him every couple of weeks, even though I knew that what I did hands-on was a drop in the bucket, because 20 minutes or 30 minutes of me moving his wrist would never keep that wrist active, and it would never get that movement back if that's done once every 2 weeks. But what I did in every session was I made a point of pointing out his successes to him. Because every time he came, he thought he didn't make any progress. And then I could show him in my notes what I'd written last time, how far something could move, which muscles couldn't move that now is starting to twitch. I made him focus on the fact that there was no twitch the previous time that we tested it, and now there is a twitch. Because it's amazing when you're stuck in that position where nothing seems as if it's getting better, and you're so far away from the thing that you want to be doing. For him, it's playing golf and working in the garden and writing. I mean, it was his right hand. He couldn't write. He was having to write checks with his left hand. That you feel it's not worth trying and you just give up because it's easier to do things with your left hand. Now, I saw him yesterday, and you know what? He can lift his arm to there. Fine, he hasn't got full range, but that's functional because he can now reach the back of his head and wash the back of his head and do everything up there in the garden that he wants to do. Because let's face it, he's 87. The other arm doesn't go much higher than that either. His elbow is 90% straight, I would say. He's about there. He's got full function of extension and flexion. He's now got a chunky forearm again because his fingers can move. His wrist, which was rock solid, which I thought was bone on bone, which wouldn't move again, is now a lovely smooth movement. Not full range, but where the other one can do that, that one can do that. And that's functional, and it's a soft movement. There's none of that cracking going on. For his hand function, he could not get his hand past that. And it was with straight fingers like that. He can now get his hand closed. His thumb, this one is stuck. This one is rock solid, and it's going to take a dedicated effort for him to get this one moving because there's no movement there, and it is still that bone-on-bone feeling. But this joint, which used to be stuck, he can now touch that one, and he has about 40 degrees there. Now, the reason this matters is because now he can write with that hand. He can type on the computer. He's working in the garden. He actually came to see me because he put his back out because he had 180 plants that he planted out into his garden. So you can see what a loss to his function this man's hand was to him. But a year and a half later, he has nearly full function of it. But if you asked him 6 months in whether that was possible, he would have said absolutely not, because at 6 months, he still didn't have any hand function. And for all I knew, it wouldn't come back. But because we kept on pointing out his little successes and his small victories, it kept him motivated and it kept him going, and it meant that he kept on working at it, and it eventually came back. So I guess what I want to say with this rant of mine is that nobody knows what the best is that you can be. Yes, you have to acknowledge and accept that you will likely not be as good as you were before, but that doesn't mean that you won't be able to do the things that you want to do with a tiny bit of an adjustment. So I hope that helps, and I hope that inspires you. But if you're struggling with it, my top tips are: keep a diary, and in that diary, you don't just write down how miserable you're feeling. You go and think of things you are struggling with at the moment. You go and look at what you can do, and you document, even if you have to do it as a video, to show yourself so that you can look back in 3 months' time when you feel nothing is improving and you fill in those same things again, you can see how much improvement you've made. And then if you struggle with that, find somebody who can help you with that, whether that's a physio or osteopath or just a friend or your partner, that they can help and point out the things that you can now do that you couldn't do before. Because all of that is relevant, and all of that is a sign that you are continuing to improve, even though it's not the improvement you want to see, but that is a sign that the improvement you want to see may still be able to happen. And honestly, there's no quick fix for these type of things. They can take 2 years. I've even seen people improve after 4 to 5 years for certain things, especially if there are nerves involved. So yes, that's enough from my side tonight. Excellent. So if you've got any questions about anything you want, you've heard here tonight, pop them in the comments. I'm hard at work with the membership site that you guys requested that will have loads of information about strength training on there. I'm making it a one-stop shop for everything. So it means that if you want strength training exercises for running, you can go there. You will find loads of progressions for glutes, how you know when you're ready to move on to the next exercise. Same for every part that's important there. It will have tests there to test your strength and know how well you're doing with regards to what I would want you to be able to do if I saw you in clinic. It will also have an injury section there that I will slowly add more and more injury treatment guides to it. So it will tell you about how you can know that you've got a certain type of injury, when you should look for help, but it will also tell you what type of exercises to do at every stage and how you will know if you're ready to move on to the next exercise. So if there's anything specific that you want in that membership site, let me know, because it's going to be member driven and everything you request will eventually be added to that. Unless it's massively above my technical computer skills, then I may have to get somebody in to do it. But the idea is that there will be videos as well as pictures as well as written stuff, so that you can get it in any format that you want.